An ectopic pregnancy is a dangerous complication. It's important to know the first signs of an ectopic pregnancy, so stay tuned. The tricky part is that the first signs of an ectopic pregnancy are exactly the same as the first signs of a normal pregnancy. There are no symptoms that can confirm with 100% certainty whether you have an ectopic pregnancy or not. That's why, if you feel suspicious, you should see your doctor right away. If you are currently pregnant, there are 3 possible outcomes: a normal pregnancy in the uterus, a pregnancy inside the uterus that is going to miscarry, an ectopic pregnancy where the embryo implants outside of the uterus. An ectopic pregnancy happens when a fertilized egg grows outside the inner lining of the uterus. Normally, a fertilized egg travels to the uterus to attach itself. But in an ectopic pregnancy, the egg attaches elsewhere outside the uterine cavity. Most ectopic pregnancies occur in the fallopian tube, which is why they are often called tubal pregnancies. But they can also occur in other rare places, such as the cervix, the ovary, or even the abdominal cavity. Unfortunately, an ectopic pregnancy cannot develop normally and will eventually result in the death of the embryo. It is a serious medical emergency because if left untreated, it can cause life-threatening internal bleeding. The fallopian tube may rupture, leading to bleeding, shock, and even death. Several conditions can be linked to an ectopic pregnancy, including inflammation or scarring of the fallopian tube, hormonal imbalance, genetic abnormalities, medical conditions that cause the fallopian tube to be misshapen. Some factors that may increase the risk of ectopic pregnancy are a previous ectopic pregnancy, sexually transmitted infections such as gonorrhea, previous tubal, abdominal, or pelvic surgery, multiple abortions, smoking, maternal age of 35 or older, pelvic inflammatory disease, PID, use of assisted reproductive technology, a history of infertility. The symptoms of an ectopic pregnancy can vary, but may include breast discomfort, vaginal bleeding in varying amounts, sudden, sharp lower abdominal pain, pelvic pain or discomfort, dizziness, or fatigue. In some cases, however, there may be no symptoms at all. To diagnose an ectopic pregnancy, your doctor may first perform a pelvic exam. This can help identify areas of pain, tenderness, or a possible mass in the fallopian tube or ovaries. A pregnancy test may also be done to confirm that you are pregnant. This usually involves a blood test to measure the level of the hormone human chorionic gonadotropin, HCG, which normally rises during pregnancy. An abnormal pattern in the rise of this hormone can be a warning sign of an ectopic pregnancy. A transvaginal ultrasound is often used to see the exact location of the pregnancy. In rare cases, a laparoscopy may be necessary to confirm the diagnosis. The treatment approach depends on your symptoms and the stage at which the ectopic pregnancy is discovered. The drug methotrexate is often prescribed to treat an early ectopic pregnancy. It works by stopping the growth of placental cells and dissolving existing ones. This treatment may cause the pregnancy tissue to be reabsorbed, or the embryo may pass during what seems like a menstrual period. It is extremely important that an ectopic pregnancy is confirmed before this medication is given. After treatment with methotrexate, conception may need to be delayed for several months. If bleeding has already started, surgery may be required. This can be done through laparoscopy or laparotomy, both of which provide access to the pelvis. The ectopic pregnancy may be removed on its own, salpingectomy, or the affected fallopian tube may also be removed along with the pregnancy, salpingectomy.